Welcome to Healthy Habits. We are so glad you found us. Here at Healthy Habits, we are dedicated to helping you live your healthiest and happiest life. Our channel is all about sharing practical tips and advice for improving your nutrition, staying active, and maintaining a healthy lifestyle. Whether you're looking to lose weight, boost your energy levels, or just feel better overall, we've got you covered. Our team of experts will provide you with the latest research and recommendations for living a healthier life. So join us on this journey to better health and wellness. Subscribe to our channel and hit the notification bell to stay updated on all of our latest videos. We can't wait to share our healthy habits with you.
Signs of ovarian cancer every woman must know. Ovarian cancer is a type of cancer that affects the ovaries, which are the female reproductive organs that produce eggs and hormones. The ovaries are located on either side of the uterus, and each ovary is about the size and shape of an almond. Ovarian cancer develops when cells in the ovary begin to grow uncontrollably, forming a mass called a tumor. As the tumor grows, it can invade nearby tissues and organs, and cancer cells can spread, metastasize, to other parts of the body. It is often called the silent killer because it can be difficult to detect in its early stages, and symptoms may not appear until the cancer has advanced. Please note that this video is for educational purposes. If you have any health concerns, please talk to your doctor. In this video we are going to talk about the common signs of ovarian cancer. The American Cancer Society reported that around 22,000 new cases of ovarian cancer were diagnosed in 2021 and almost 14,000 women lost their lives. Ovarian cancer can be cured, but you need to get treatment as soon as possible. Women who were diagnosed don't have any symptoms until the disease is advanced. There are several types of ovarian cancer, each with different characteristics and treatment options. The most common types of ovarian cancer include epithelial ovarian cancer. This is the most common type of ovarian cancer, accounting for about 90% of all cases. It begins in the cells that cover the surface of the ovary. Epithelial ovarian cancer can be further classified into subtypes based on the type of cell in which the cancer originates. Germ cell tumors. These are less common than epithelial ovarian cancer, accounting for about 5% of all cases. They start in the cells that produce eggs. Germ cell tumors can be benign, non-cancerous, or malignant, cancerous. Stromal tumors. These are rare, accounting for about 5% of all cases. They start in the cells that produce hormones. Stromal tumors can be benign or malignant. Borderline ovarian tumors. These are tumors that have characteristics of both benign and malignant tumors. They are considered less aggressive than malignant tumors, and may have a better prognosis. Metastatic ovarian cancer. This is cancer that has spread from other parts of the body to the ovaries. Some common early ovarian cancer symptoms may include frequent bloating. One of the most common signs of ovarian cancer is a feeling of bloating on a regular basis. This can be accompanied by pain in the lower abdomen, which is often mistaken for menstrual cramps. Some women may also experience constipation or diarrhea. If you are experiencing bloating that's accompanied by pain or other unusual symptoms, it's important to see your doctor to rule out ovarian cancer. Lower back or pelvis pain. This can occur as a symptom of ovarian cancer because the cancerous tumor can grow and press on nearby organs, such as the bladder, rectum, and lower back. This pressure can cause pain in the lower back and pelvic area. The tumor can also cause inflammation in the pelvic area, which can cause pain. This may be worse after periods or bowel movements, and it can be persistent or come and go. Pain in the pelvis or abdomen usually spreads to the groin area. The pain may worsen with exertion such as coughing, sneezing, or lifting heavy objects. Constipation. It can occur as a symptom of ovarian cancer because the cancerous tumor can grow and press on the rectum or other nearby organs. This pressure can cause the muscles in the rectum and intestines to slow down, making it difficult for stool to pass through. The tumor can also cause blockages in the intestines, which can cause constipation. It is important to note that constipation can also be caused by a variety of other factors, such as a low-fiber diet, lack of physical activity, and certain medications. Kindly watch our video on how to relieve constipation using plum syrup. Fatigue. It can occur as a symptom of ovarian cancer because the cancerous cells use up a lot of energy, leaving the body feeling tired and weak. The cancer cells can also cause inflammation in the body, which can lead to fatigue. Additionally, anemia, low iron levels, is a common side effect of ovarian cancer, which can also cause fatigue. Abdominal pain and swelling. These symptoms are caused by the tumor growing in the ovaries and can cause pressure on the organs in the abdomen. As the tumor grows, it can cause the abdomen to become distended, which can cause a feeling of fullness and bloating. The tumor can also cause inflammation in the abdomen, which can cause pain. Feeling full quickly when eating. This can occur as a result of the tumor growing in the ovaries and taking up space in the abdomen. This can cause a feeling of fullness or bloating even after eating small amounts of food. The tumor can also cause pressure on the stomach, which can make you feel full more quickly. Some feel sick if they eat too much. They may also have diarrhea, nausea and vomiting after eating. Frequent need to urinate. Ovarian cancer can cause pressure on the bladder, which can lead to a frequent need to urinate. This can be caused by an enlarged pelvic tumor pressing on the bladder or ureter, which is the tube that connects the kidneys and bladder. Most women do not experience frequent urination before being diagnosed with ovarian cancer. It's still important for women to pay attention to these symptoms. Change in the menstrual cycle. Ovarian cancer can cause hormonal imbalances, which can affect the menstrual cycle. For example, it can cause an increase in estrogen, which can cause heavy or irregular periods, or it can cause a decrease in estrogen, which can cause light or infrequent periods. Ovarian cancer can also cause changes in the ovaries, which can affect the menstrual cycle. Symptoms of ovarian cancer vary from woman to woman, and some people don't have any symptoms at all. Doctors recommend women get screened for ovarian cancer starting at age 35. It's important to know what symptoms you should be looking for: a change in the menstrual cycle. There are several methods used to detect ovarian cancer. Pelvic examination. It is a physical examination of the pelvic region and can include a manual examination of the ovaries and uterus. Transvaginal ultrasound. This test uses high-frequency sound waves to create images of the ovaries and uterus. It can detect cysts or tumors on the ovaries. CA-125 blood test. CA-125 islander protein that can be present in higher levels in women with ovarian cancer. A blood test can measure the level of CA-125 in the blood and can help detect ovarian cancer. Pelvic and abdominal CT scan. A CT scan uses X-rays and a computer to create detailed images of the ovaries, uterus, and other organs in the pelvic and abdominal area. MRI. A magnetic resonance imaging (MRI) scan creates detailed images of the organs and tissues in the body. Biopsy. A biopsy is a procedure in which a small sample of tissue is taken from the ovaries and examined under a microscope to check for cancer cells. It's important to note that these methods are not always 100% reliable in detecting ovarian cancer, especially in early stages. Often, the symptoms of ovarian cancer are subtle, and the cancer may not be detected until it has spread. This is why it's important for women to be aware of the signs and symptoms of ovarian cancer and to talk to their doctor about getting screened for the disease. Treatment options vary depending on the stage and type of a woman's ovarian cancer. Treatment options for ovarian cancer include: surgery is the most common treatment for ovarian cancer. The goal of surgery is to remove as much of the cancer as possible. Depending on the stage of the cancer and the patient's overall health, surgery may include removal of one or both ovaries, the fallopian tubes, the uterus, and nearby lymph nodes. Chemotherapy, drugs to kill cancer cells. It can be used before or after surgery to shrink a tumor or kill remaining cancer cells. Radiation therapy uses high-energy rays to kill cancer cells. It is not commonly used to treat ovarian cancer, but it may be used in some cases to relieve symptoms caused by the cancer. Targeted therapy uses drugs to target specific changes in cancer cells that allow them to grow and survive. It is used in some cases of ovarian cancer. Immunotherapy uses drugs that help the immune system attack cancer cells. It is a newer treatment option and is being studied in ovarian cancer. The choice of treatment will depend on the stage of the cancer, the patient's overall health and the patient's preferences. It's also worth mentioning that after completion of primary treatment, patients need to be followed up regularly with the oncologist to check if there's recurrence of the cancer and to monitor the side effects of the treatment. It's important to consult with your doctor if you have any concerns about your health and if you have any symptoms that persist over time. Your doctor will recommend appropriate treatment based on the stage of the cancer and your overall health.
Thank you for watching this video on healthy habits. We hope you found the information helpful and are motivated to make positive changes in your own health and wellness journey. Don't forget to subscribe to our channel and hit the notification bell to stay up to date on all of our latest videos. We post new content every week, so there's always something new and exciting to learn. If you have any questions or comments, feel free to leave them in the comments section below. We love hearing from our viewers and always do our best to respond to your comments. Thanks again for watching, and we'll see you in the next video.